Dr. Jaffe, the Marshal Immune Enhancement Protocol has been around for quite some time. We have some practitioners writing in asking for your take on this and your explanation. Will you share that with them, please?
Yes, there's a short answer and a long answer. The short answer is that Dr. Marshall, an excellent clinician, learned from people who misunderstood hormones. They misunderstood vitamin D, a neurohormone, and they were thinking in mechanistic and pharmacologic terms, not in functional and physiologic terms. And when you do that, one of the consequences is you end up treating the good as if it's bad and the bad as if it's neutral. What do I mean by that? Well, what I mean by that is, if you follow the Marshall Protocol, you would dramatically reduce your vitamin D from low to even lower. And that we now know, and this is in hindsight, but clearly documented at a scientific and clinical level. If you follow the Marshall Protocol, the low consequential vitamin D will dramatically increase your heart disease, your senility, your risk of chronic infection, of autoimmunity, and of repair deficit inflammation. So if you start from a misassumption and only talk to your friends who share that misunderstanding, you end up with the Marshall Protocol. And yes, it has been here. It's been decades that people have been reading because he was an excellent clinician who did not follow his own protocol. So we want you to apply physiology before pharmacology, apply our approach to evoking human healing responses. That means a vitamin D level between 50 and 80, and the way to get there is usually with drops under the tongue. And now you reduce dramatically, and I mean dramatically, your risk of cancer and heart disease, your risk of stroke and senility, your risk of organ failure from kidney to liver to spleen. So in hindsight, a very smart man who has followers, who like him misunderstand the physiology, and in my experience, end up creating what they fear. My recommendation, understand in a contemporary 21st century way the many important roles of vitamin D and K2 and other members of the nutritional essentials team. Know what the target is for a healthy vitamin D range, and follow this physiology before pharmacology approach to sustain good health for decades, rather than hold to a philosophy that was based on a fatal flaw to begin with.
Thank you, Dr. Jaffe.